I'm back. Sorry, hospital, there's always the ins and outs of the wonderful staff here checking on me and making sure everything's okay. So anyway, as I was saying, they had to start, they wanted me checked back into the hospital right away, and they were going to start me on a low-dose chemo, and while they had those, it was like a 2-part medicine, and then once it was approved from the insurance and they had that in hand, they would work about getting the MEN inhibitor, because most insurances will deny that right off the bat. And they can't request them both at the same time or they both get denied. So, but later last night, after I had left the doctor, Dr. Gabby called me about a clinical trial that's in phase 2 for a menin inhibitor. And it was basically the same thing that we were going to try and get anyway. And so this helps me forgo the chemo, which is great. I should back up. That other option, the first option, is going to be here again for anywhere from a week to a month on the chemo regimen. And then I would have to do daily blood checks, and every month I would go in for 5 days for an injection. This clinical trial for the menin inhibitor it's pills twice a day. I do have to stay here for for about a week or so, but that's a little bit different. So right now they got to try and get my white blood cell count down, I think it is, because it's flooded my body, and it's flooded it with immature blood cells. And so I can't remember what they're going to give me, but they're going to give me a medication to reduce that while we wait for final approval for me to be on the the clinical trial. And so today has been a rough day. We checked in this morning, another bone marrow biopsy, which this one hurts like hell for some reason. Usually it's on the left side that they go. This time they went on the right side of my back, and I don't know, it just hurts. A nice new PICC line. Well, that's the IV line, but I got a PICC line down below it, or above it. Which, I was really happy to be without that for a month. It was great. But that will get traded out for a chemo port as soon as my platelets are up high enough for it. And then there was some additional tests and stuff that they had to do to send to the clinic, the study, or the host is what they call them, to basically get all of, I don't know. Anyways, bottom line is by Monday or Tuesday, we should know if I've been approved for that study, and if I have, they'll immediately start giving me that medication. And as part of the study, for the first couple rounds, I have to come in 3 days a week for blood draws and stuff. And then after that, it's like 2 days a week. And then on the 4th round, I think it is 1 day a week. So it's a lot more friendly on the, driving, because getting here 7 days a week gets really rough for me. So with all of that, so there's options. If this clinical trial just isn't working for me, I can stop it at any time, and they can go back to the chemo regimen, so Plan A, which is a different chemo than I've been on. They can't give me the same chemo because obviously it didn't work. It didn't get rid of all of the disease, so it's pointless to do it again. So they will try a secondary medicine, or a different chemo combination. So those are the options. I honestly, they told me that, lifespan is going to be probably 12 to 18 months. I might get 2 years still, but because of how fast and how rapidly it's hit my system, it sucks. Not going to have it for a while. Not going to be around for a while. It also changes the bucket list up a bit because with the clinical trial, I had to be able to go in clinic for these things, these blood tests and stuff, until I hit that mark of 1 day a week, which puts us out a little bit too far, I think, for the road trip, because it would put us out in the winter. And I really want to swim in the ocean one last time, maybe not so, in middle of December. So if I'm still around next year, we can try it again next year. So we might be shifting to the Hawaii trip on the bucket list, and of course my Supernatural convention in January. So the nice thing is CreationNet, Tasia, my eldest, reached out to CreationNet, and they gave me 2 passes, general admission passes that are upgradable. So I'm saving to upgrade those to gold passes for both of us. And then they gave me a free photo op for Jensen, Jared, and Misha. So I'm really excited for that. And I gotta go again. But peace out, guys. Thank you.